Welcome to Ceva Piglets Health Talks, where we have invited guests in the studio to a debate of what's going on in the stable. Your host is swine consultant from Ceva, Henrik Bech Pedersen.
Hello everybody. Today's episode is spotting high quality piglets, and today I have two skilled vets with me in the studio, and the first is Dr. Veterinary Medicine, Michael Agerley. Would you present yourself, please?
Thank you, Henrik. Yes, my name is Michael Agerley. I'm a part owner in Porcus, a veterinary company in Denmark. We are 22 vets consulting Danish farms.
Okay. And the other guest is my colleague. He is also a veterinarian. It's Dr. Veterinary Medicine, Michael Albin. Will you present yourself, please?
Yes, my name is Michael, and I have been consulting piggeries like Michael also for 8 years, and the last 8 years I've been working for a pharmaceutical company.
Thank you, both of you. And the topic today is how to spot the high quality piglets, and how to take care of the piglets, and how to take care of the sow before, under and during the farrowing. And Michael Agerley, I would like to hear from you. What is the most important things before you put the sow into the farrowing pen, and what preparations would you do before farrowing?
Yes, it's a very good question. There are some factors that are very important in preparation of the farrowing barn. First of all, we need to do a correct cleaning, which is cleaning away all the shit and dirt in the pen, washing with soap, and then disinfecting the area. Afterwards, we need to ensure that we dry out the facility adequately, and we need to make sure that the piglet corner or the nest for the piglets is warm and ready to receive newborn piglets.
And how do we check all these things? When you have been doing the procedures, how do we check that all the things is okay and correctly adjusted?
Well, of course, with cleaning, it's very good to start just to use your eyes to see if it's visibly clean. Is it visibly dry? So the stable needs to feel dry, and you should not be able to see any humidity in the stable. Of course, you need to ensure that you have been using adequate amount of soap and disinfectant. And in the piglet nest area, you can measure the temperature on the floor and check that it's on 36 degrees.
And how do we check the temperature on the floor?
You can use a laser thermometer, but you can also use your hands because your body temperature is 37 degrees, so it needs to feel like body temperature.
Yeah. So about 36, 37 degrees on the floor.
Yes, then we are ready.
And what about the sow, Michael Albin?
Well, the sow is extremely important because she's going to take care of the piglets. So the first thing that we have very much in focus in Denmark, and that is the back fat. The body score condition is extremely important. If they're too skinny or they're too fat, that's a disaster. They can't take care of the piglets. They have to be perfect in body score, and that's about 15 to 18 millimeter back fat. So I recommend to measure the back fat at entering the farrowing pen.
So you're saying the body condition is one of the most important conditions, and one of the very important topics we have to deal with.
Yeah, we call it fit for fight.
Okay. When the sow is entering the farrowing pen and during the farrowing, what do you, Michael Agerley, find most important during the farrowings and the hours after farrowing?
Well, starting a little bit earlier, when we get in the sow, 3 to 4 days before farrowing is a really good time. We need to ensure that she has access to water and feed, and that she's eating as she should. And we also need to make sure that she doesn't have any temperature or other illnesses we need to take care of, so that she's ready for having pigs and taking care of the pigs.
And you do that by looking at the sow, or do you have some procedures or rules you follow?
Well, using your eyes is a very good place to start. See in the trough if there's water and feed. If it's wet, then she has access to water. If she has eaten her feed, it's a good sign that she's healthy. Follow the feeding and see that all your sows get up and eat at feeding.
Okay.
And the sows that do not or get up slowly, check them and treat them if necessary.
And Michael, Albin, do you have a comment on that?
Oh yes, I have experience regarding the udder. If it's very hard of edema, I would try and find out what is the reason for that and treat them with NSAIDs.
Okay. I very often hear that the time after farrowing, the first hours where the other piglets should take the colostrum is very important. How do you see that period after farrowing?
Yes, you are absolutely right. It's a very critical area to ensure, or critical time, to ensure that the pigs drink colostrum, because if not, they get a very bad immunity. And the first thing I would do when I go to a farrowing barn in the morning is to ensure exactly that. Start with putting the pigs in the corner so they get heated up. Maybe give the smallest piglets a booster of energy, which can be sugar, syrup, commercial boosters. Mark up the skinny small pigs, feed the sow, and when the sow lies down, then take out the smallest piglets first to ensure that they get colostrum.
So you are splitting the litter in the first few hours after they have been taken away in the corner? Yes,
and I would take out minimum 10 to 12 pigs so that there are enough pigs to activate the udder of the sow.
Okay, and how long time do you do this kind of split milking?
Usually half an hour to an hour.
Okay.
We can facilitate it sometimes by giving the sow a little bit oxytocin when we take out the smallest pig, so we are sure that she is ready to lie down milk or give milk. Mm-hmm. So in some farms we do that, in other farms it works fine without.
Very often we see that we have young and we have older sows, we have gilts, and the variation in how many piglets they born, and the variation of the piglets born from sow to sow is very huge. So we see some have maybe 12, 14, up to 22, 24. How do we do with the variation between the litters? How do you equalize the litters, and when to do it?
So when we have finished the first process, which is getting the pigs heated up, identifying the weak piglets, making the split nursing, so we know the weakest piglets have gotten milk, then we start to, at the same time, we can start to count how many tits does the sow have, how many good working tits, and write that either on her card or somewhere else. And then we have in some litters extra pigs, and in some litters we might have some more space. Then we start to even out the pigs, so there's one pig per tit. And what is very important in this process is that we fit the pigs to the sow. So if we have a very big sow, that we give her bigger pigs, and if we have a smaller sow, we give her a little bit smaller pigs maybe. And then the excess pigs we might have, we put for foster sows.
Okay.
And this should always be the bigger pigs, because it's a stressful event to make a foster sow.
And it's because they have more energy at the body. They can maybe go 12 hours more before they starting eating, or why do we do that decision?
Yeah, we take the bigger pigs exactly because they are stronger, and they have a little bit more time left in them, so they have the ability to endure or to wait a little bit longer until their new mother, the new foster sow, stresses down and gives the milk for the pigs.
And how many days do you think how many days do we have to switch and these piglets between the sows? So
for me, once we have equalized the litters, then we have found a tit for every pig, which is a job we finish the first day.
Okay.
And then the next 4 to 5 days, it's very important that we observe all the piglets every day. And what we mainly check for is if they look hungry. So if their belly is flat or doesn't look full, those pigs we mark. We do that once or twice daily, depending on the size of the farm.
Mm-hmm.
And these hunger pigs, we would call them, we collect and put to a sow that has a lot of milk from the same age. So we might collect 10 to 14 hungry pigs and put to the best sow in that farrowing week. And how do we know it's the best sow? It's because her piglets look the best. They look the healthiest, the roundest. Then we put those pigs there, and we take her pigs and put back. And why do we put them back? It's because we need to, the sow's milk production is a push effect. So a sow needs to have strong pigs sucking on their teats to stimulate her milk production. So that's why we have to put the bigger pigs back.
And what about the piglets where you see hunger when they are older? After the 4 and 5 days, what do we do with the pigs who is dropping out when they're getting older?
Yeah, so after castration, which is between day 3 to 5 usually, we stop moving around hunger pigs, or we stop filling up the places where we remove the hunger pigs. So if we see hunger pigs, and usually we will see some, we collect the hunger pigs and put them for a nursing sow, but we don't put her pigs back. So it's one step where we remove the pigs for a nursing sow, and then we don't touch the pigs again.
Okay, and then you close the litter and don't touch them.
Yes, and we do this for not mixing around diseases.
Okay, and what about diseases? Do we have another procedure if you have a huge virus load in the farming unit or other diseases? Do we do the same procedure if you also have a lot of diseases?
We change the procedure. So usually we, as I explained, we fill up litters. We take away hunger pigs, put them for what we call a super sow, take her pigs back to stimulate the udder. But if we have, for example, a big outbreak of virus, which could be PRS, we stop doing this procedure already on day 2.
Okay.
And after day 2, we only collect and then we lock the litter.
Okay.
To avoid transmission of disease.
And now we're talking diseases. What is the most common challenge? I'm thinking most of diarrhea here in the first days after farrowing.
Even though we have done all the procedures correct to avoid diarrhea, it can happen that we see a neonatal diarrhea within the first 2 days. And that could be E. coli. We find very seldom F5, 6, and 41 type, but if you find E. coli, it could be because that we have not vaccinated properly against neonatal diarrhea via colostrum.
One of the most important diseases in the farrowing unit is diarrhea, but especially diarrhea in newborn piglets. So diarrhea from day 0 to day 2. And a very good point is to ensure that the sows and the gilts have been vaccinated correctly, and that this procedure is done and followed well. But still in many farms, it's not enough to control the diarrhea in newborn piglets. Especially we see this type of diarrhea in piglets born from gilts. We also see it very often in the litters where we collect maybe the smallest piglets after farrowing. And this diarrhea is very important to control to have success in the farrowing unit and a low mortality.
I know some are working on a third vaccination of the gilts before farrowing. Do you believe in a third vaccination instead of 6 and 3 weeks before?
Well, clearly we can say, why is it usually the piglets from the gilts that get this diarrhea? It is because the gilts have the lowest immunity, and they give the lowest immunity to the piglets. We can also do a very simple procedure in many farms, and that is coloring the piglets from the gilts with maybe a strong blue color, and then follow them the next days. And in many farms you will see that the piglets that get diarrhea are the ones born from gilts. We can also see a little bit more diarrhea in piglets that we move to gilts in the beginning, and that's because the immunity in her colostrum is lower. So for me, it makes sense to boost vaccination on gills. And in some farms we use a broad spectrum Clostridium vaccine, which has a good effect. And also it's very important to do a correct treatment against diarrhea in these piglets. So in many farms we can do a lot against neonatal diarrhea just by treating the piglets from the gills and the pigs that stay with the gills on the first and the second day with an antibiotic that has a good effect.
But then you have to be very quickly.
It's really the key message is to do it almost automatic, because if you wait 12 hours or one day, the diarrhea is already so severe that the piglets don't really recover.
So you recommend that this procedure is a steady procedure where you check these gills every time we have the farmings. You check the gills every time.
I would check the gills and their piglets. If I see just one yellow spot of diarrhea, I would treat the whole litter. I would do the same in the litters with the weak piglets that we collect, and sometimes in the first step foster sows. But very important is shoot first, ask later when you see diarrhea.
Okay. Thank you, both of you. I think we have to wrap it up now. And if we have to take some key measures, I think one of the important ones is that you have to be very much aware of the gills and the piglets at the gills, and the tip with marking of the piglets from the gilt, and follow them in the other litters and see how disease or diarrhea are spreading from litter to litter when you move the piglets from the gills. And that will be a very valuable knowledge when you have to prevent diarrhea later on. Thank you, both of you, to Michael Albin and Michael Agerley. Thank you for participating in this episode.
Thank you.
You're welcome.
Thank you for listening to Ceva Piglets Health Talks. Please stay tuned for the following episodes.